Hi, thank you so much, everyone. Good evening, good morning, and good afternoon. So I'll be talking about subthreshold laser therapy guidelines for retinal diseases on behalf of SOLS Society. And I will just give you the brief introduction how we came about this. These
These are
are
my financial disclosure.
These are my financial disclosures, and none are relevant to the Soul Society. So before I really jump onto the guidelines, I would just give the brief introduction that SOLS is Subthreshold Ophthalmic Laser Society with the goal to facilitate the discussion between specialists and professionals in this industry and to overall encourage the research opportunities and innovative collaboration in subthreshold laser field. These are the founding members. This all started in somewhere in 2020, where we started talking about this, and there is certainly a need. And then we have an executive committee spread across the globe. We have many experts around the world, and it's really glad to work with these smart guys who have so much experience of with subthreshold laser. So with the aim of this society, we have established this website. I just brought in when Ken was mentioning, is that this website is pretty much just being built up right now, where we are trying to bring more educational videos and important publications, which will help us to our readers, viewers, as well as building up the research opportunities. So today I'll be talking about the subthreshold laser therapy guidelines for retinal diseases, which we established on behalf of Soul Society. Why do we need guidelines? Because subthreshold laser has been utilized in clinical practice for more than 3 decades. There have been numerous randomized and real-life studies which have proven the efficacy and safety of this subthreshold laser in various retinal diseases. However, despite of decades of usage, we still do not have a standard protocol for subthreshold laser applications and settings. And as you saw that as soon as we started the webinar, there was so many questions about the basic settings for subthreshold laser. So we really wanted to establish a consensus guidelines for subthreshold laser therapy in retinal diseases, for which we had 12 experts. We established 43 questions, all spread across the different settings, applications, and particular diseases. In the first round, we sent across these questions, and we obtained responses in the masked manner. And then we had 2 virtual meetings in which we discussed about each and every question and what should be our consensus guidelines. Before I really jump on to the guidelines, I would specifically say that these guidelines are independent of any specific laser device. They are very much towards the subthreshold laser, as Ken mentioned very clearly, that whether it is micropulse by Iridex or microsecond by Nevilas, they all fall into one category as per the expert, that is subthreshold laser. So let's start with diabetic macular edema. It's one of the challenging diseases. However, the SOLS expert believe that there is a role for subthreshold laser in both center involving as well as non-center involving with or without adjunctive anti-VEGF therapy. We recommend 5% duty cycle with 200 millisecond pulse duration and 150 to 200 micron spot size without any space between the laser spots using an integrated pattern system. As Ken was mentioning, we support that we should do the titration using subthreshold laser, and wherever you get the threshold power, just cut it half to 50% and use that power as your subthreshold micropulse laser in 5% duty cycle. SOLS expert recommend applying these laser to edematous areas. However, it does not mandate any focal treatment for micro aneurysms. Continuing with diabetic macular edema, we all believe that transfoveal treatment is safe. However, we need to reconfirm the subthreshold laser safe settings before applying. We do not recommend any specific structural imaging studies to evaluate the laser spots because we believe it is a subthreshold laser. If you used the correct settings, you really don't need to, you should not have any structural damage. However, we would still recommend that during the follow-up visits, you can perform non-invasive techniques such as autofluorescence or OCT to evaluate if you are seeing any laser damage on these structural imaging modalities. We recommend follow-up evaluation at 6 to 8 weeks after the subthreshold laser. However, repeat subthreshold laser is suggested after 2 to 3 months of initial application in case of poor response. I would just like to emphasize that what we are promoting or discussing now is the subthreshold laser settings. We are not recommending treatment for diabetic macular edema, seeing that the diabetic macular edema treatment can be performed as per the physician discretion, whether they want to add anti-VEGF therapy on steroid therapy in response to the subthreshold laser. These are very specific subthreshold laser settings, not the management of diabetic macular edema. That's because that's a much more bigger question and depending upon various factors. Let's move on to central serous chorioretinopathy. SOLS expert recommend the subthreshold laser in both acute as well as chronic types. For acute CSR, we feel that considering the safety of this subthreshold laser, we would like to apply subthreshold laser 1 month if there is no resolution, unlike the conventional 2 to 3 months of observation. For chronic CSCR, SOLS expert supports subthreshold laser as first line, as well as combination therapy with other treatment modalities. Again, we are supporting 5% duty cycle with 200 millisecond pulse duration and 100 to 200 micron spot size with titration in the same way of using subthreshold laser and applying 50% of the threshold power. Settings are same for both acute and chronic CSCR with no spacing between the spots using integrated pattern system. Again, we support transfoveal laser application. We all have experienced safe outcomes with transfoveal laser application. However, again, you need to reconfirm the subthreshold settings before pressing the foot pedal. For acute CSR, we recommend focal leak areas and adjacent area. For chronic CSCR, SOLS expert believe that we can perform laser for focal as well as diffuse hyperfluorescence seen on fluorescein angiography. Again, we do not expect there would be any damage because of subthreshold laser. However, performing autofluorescence or OCT could be useful in evaluating any laser damage. In patients with CSCR, we would like to evaluate the effect of laser in 6 to 8 weeks. In case of poor response or persistence of subretinal fluid, a repeat treatment with same settings is recommended. However, if physician believes that we can supplement and add additional treatments such as oral or other form of treatment, they are free to do so. Again, these were very much subthreshold laser settings. We are not recommending a treatment protocol or treatment algorithm for CSCR. These are the summary of the table. I would recommend that you should go through this publication, and they are very simple, straightforward settings. With this, I would like to conclude that these consensus guidelines do not suggest management of these diseases, but suggest laser application guidelines using different subthreshold laser delivery systems. We do not support any specific laser delivery systems. These are very much subthreshold guidelines. The goal of these guidelines is to establish standard subthreshold laser application in clinical practice, and we hope to start various clinical trials to establish level 1 guidance, level 1 evidence for these subthreshold laser in various diseases. This publication came out in this is, I believe, open access. So you all can go through this publication and give us your feedback and share your experience. Thank you so much. And I would like to acknowledge all the SOLS experts in working with this publication and helping this to establish these guidelines. Thank you so much for your attention.